We're good. Hello and welcome to the Midday. I'm Melanie Lawson. Hope you're having a great Thursday. We want to get right to your news update, but today in particular, we are going to be talking to emergency physician Dr. Darian Sutton. He has been working on the front lines of the pandemic in New York. And Dr. Sutton, always good to have you. We appreciate your taking a few minutes with us again.
Yeah, good afternoon. How are you?
Doing good, doing good. Let me start right away because Texas is certainly one of the states that is really experiencing an increase in the number of COVID-19 patients we're seeing, as well as in the number of deaths and things. We know in the beginning New York was really struggling, but what do you think you all did that turned it around for you?
Yeah, so I've definitely seen those numbers, and they're definitely concerning regarding Texas. What I can say about New York is that when we started this pandemic, or the fight against it, in April and March, we had a clear, concise, concerted effort from everyone in order to socially distance, wear a mask, and practice hygiene in terms of washing hands. And hopefully we can continue that effort while we continue to fight this fight. But as we see numbers increasing in Texas, I think it's really, really important to help people understand the benefit of wearing a mask and socially distancing.
Now, if somebody is sick enough to need to have to go to the ER, you know, we've all been told don't go with just minor symptoms or anything like that, but what should they expect the moment they walk in the door, and what advice would you give them about when to go?
Yeah, so I get this question often from my friends, family, and even some of my peers that I work with. But the easiest answer I can provide to anyone who's questioning whether or not they need to go to the emergency room or see a doctor is what I say to my friends, which is if you think that your symptoms can be handled from the comfort of your own couch on your home, then you should definitely continue to do that, self-isolate, stay home, and make sure that obviously you get tested. But if you think that your symptoms require the intervention of a medical provider like myself, then of course I encourage you to at least call your primary provider, and if you can't get in touch with them or you can't see them, then definitely come into the emergency room. In regards to your second question, what happens when you come into the emergency room? We do our best to separate patients and to triage them appropriately so that we can decrease and minimize the risk of contracting COVID inside of the hospital. You'll be given a mask immediately if you don't have one, and you'll probably be tested. But unfortunately, given the rates of increase of COVID-19 in states like Texas, the testing may take longer than expected, sometimes 2 days, sometimes up to a week. So that's probably what you can expect if you need to see medical attention inside of an emergency room.
Is your concern right now that perhaps the leadership, both on the national and state levels, leadership is not necessarily pushing hard enough to turn this around?
Yes, I think that it is difficult to understand what is going on if you're getting different messages. And I think one step that needs to be taken is that everyone needs to come in union and have a clear, concerted effort and message in terms of how to prevent this virus. And as Robert Redfield from the CDC stated, wearing a mask can substantially decrease our rates, especially if everyone participates. And we can get over this hurdle of this surge that we're seeing in certain states like Arizona, California, and Texas.
Do you think it helps now that the president has started wearing his mask and advising other people to do it?
I think so, and what I hope is that that action is repeated and understood by many. When I saw the president wearing a mask, I was very excited. I wish that it would have been done earlier with more vigor, but honestly, any effort is helpful at this point because we're continuing to do our best to fight this pandemic inside the hospital, and we need as much help as we can get outside of the hospital.
Yeah, well, you know, we're looking at other countries who seem to have brought their infection rates down. What is it going to take for the entire country to be able to really get on top of this pandemic? And are we still in the middle of it?
Yes, we are very much still in the middle of it. One barometer that I use to figure out how we're doing is the percent positive. You'll get a lot of numbers inside of reports that regard the number of cases that are positive and the number of cases, hospitalizations, but the real barometer in terms of how we're doing is that percent positive, basically the number of people who are getting tested and testing positive. And studies have shown from the World Health Organization as well as the Harvard Global Health Organization that if your percent positive is less than 10 and even better, less than 5, 95%, then you're probably doing a good amount of testing and you have a good amount of surveillance, and you can definitely keep the virus at bay. For example, the percent positive in New York is around 1%, but the percent positive in California is increasing and currently around 8%. The percent positive in Texas is around 15%, and the percent positive in Arizona is around 25%. So 1 in 4 people in Arizona are testing positive, and that is the beginning of a crisis if they're not already in it. So that's the real barometer that I use to tell and figure out where we are. And other countries are succeeding, and we need to match that success by continuing to test and continuing to encourage people to wear masks.
All right, Dr. Sutton, we appreciate it so much. Always good to see you. Thank you, and we will talk to you again soon. And I want to toss it over right now to Colin Myers, because, Colin, we're looking at something major out there in the Gulf.
You're right, Mel. Good to talk to you. Yes, we knew this was coming. The season wasn't going to stay quiet the whole time, and all of a sudden, tropical storm watches. First time I'm having to tell you this in a while. Issued all across the Texas coast. First time I've had to say this in a while. Tropical storm watch in effect for Galveston, and the main day is going to be Saturday. But Friday night into Saturday, high winds, high surf, rip currents, dangerous. Do not be out on the beach, obviously. That goes without saying. Here's Tropical Depression 8 now. We do expect this to become Tropical Storm Hannah eventually. Pressure continues to decrease, so it's a fairly healthy yet disorganized system, and we do think it'll get its act together, become a tropical storm briefly before impact, and I think landfall Friday night into early Saturday morning along the lower Texas coast. Now for us, we are not out of the woods with this. Is direct landfall going to impact us? No. But stay tuned to my Facebook updates and our live streams, because I am concerned about where the outer rain band's set up. I think the northern band is going to affect us, and I think that could be a problem where it sets up. There's the circulation now, again, still fairly disorganized, but this storm is so big, it's taken up nearly a third of the Gulf of Mexico. It's so disorganized. Wind shear has kept this really to the south, and thank goodness that high pressure was there, because that's keeping it further south, and it's not going to hit us. However, it's actually now a 90% chance of development. Tropical Storm Gonzalo as well, and this thing is going to move in late Friday night through Sunday. Bands of tropical downpours, again, no guarantee though, depending on where the rain band's set up. Some spots could certainly see some flash flooding, so we just got to stay vigilant Friday, Saturday, Sunday. Rain chances obviously going up. Tropical rains, flash flooding is going to be possible. We'll see if they issue a watch or not. A lot of information still yet to be determined as we go through the next few days, so stay vigilant. We'll be watching it closely. Obviously, Mel here at the station, and rain chances continue through next week.
Yeah, absolutely, Colin. Thank you. Sounds like a good weekend to stay home and stay on the couch. Well, that's going to do it for the Midday. I'm Melanie Lawson. Hope you have a great Thursday.